This is Wendy Rayora, and right now we will discuss about a parasite named Mansonella perstans. Mansonella perstans is a filaria nematode transmitted by tiny blood-sucking flies called midges. Mansonella perstans is one of two filaria nematodes that causes serous cavity filariasis in humans. Mansonella perstans is endemic throughout West, East, and Central Africa, and is also highly prevalent in some neotropical regions of Central and South America, where it was likely introduced. Mansonella perstans typically inhabits the human body, specifically the serous cavities and connective tissues. However, its habitat also extends to the natural environment, particularly in regions where its vector, the biting midge, thrives. These include areas with dense vegetation, high humidity, and suitable breeding. Adults are white and thread-like and have been found to be cylindrical in shape. Males are 35 to 56 mm long and 45 to 60 micrometer wide. Females are bigger, 70 to 80 mm long and 80 to 120 micrometer wide. The tail is half a coil in females and a full coil in males. Adult worms are rarely seen, but sometimes can be recovered from a laparotomy or autopsy. During a blood meal, an infected midge introduces third stage, filaria larvae, onto the skin of the human host, where they penetrate into the bite wound. They develop into adults that reside in body cavities, most commonly the pericardium. The size range for female worms is 70 to 80 mm in length and 120 micrometer in diameter, and males measure approximately 45 mm by 60 micrometer. Adults produce unheated and subperiodic microfilariae, measuring 200 by 4.5 micrometer that reach the bloodstream. After ingestion, the microfilariae migrate from the midge's midgut through the hemicoel to the thoracic muscle of the arthropod. There, the microfilariae develop into first stage larvae and subsequently into third stage infective larvae. The third stage infective larvae migrate to the midge's proboscis and can infect another human when the midge takes a blood meal. Mansonella perstans infections often remain asymptomatic, but when symptoms do occur, they can include mild to moderate itching, skin rashes, joint pain, fatigue, headaches, abdominal discomfort, swelling of lymph nodes. Severe manifestations are rare, but in some cases, Mansonella perstans infections have been associated with conditions such as eosinophilia, which is an increased eosinophils in the blood. There is limited understanding of the immunity to Mansonella perstans. However, repeated exposure to the parasite may result in some level of acquired immunity, leading to reduced severity of symptoms in subsequent infections. Additionally, the host immune response, particularly involving eosinophils and specific antibodies, plays a role in controlling the infection. Diagnosis of Mansonella perstans infection is typically made through microscopic examination of blood samples. The parasites can be observed directly in thick or thin blood smears, often in the form of microfilariae. Alternatively, molecular techniques such as polymerase chain reaction assays can be used for more sensitive and specific detection of the parasite's DNA in blood samples. Treatment for Mansonella perstans infection often involves the use of antiparasitic medications such as ivermectin or albendazole. These medications are effective in reducing the number of microfilariae in the blood, alleviating symptoms, and preventing transmission of the parasites. However, treatment may not always completely eliminate the infection, and repeated doses may be necessary. It's important to consult a healthcare professional for proper diagnosis and treatment guidance. Prevention and control of Mansonella perstans infection primarily focus on measures to reduce exposure to the vector insects such as biting midges. These may include number 1. Using insect repellents containing DEET on exposed skin. Number 2. Wearing long sleeves, pants, and other protective clothing, especially during peak biting times. Number 3. Sleeping under insecticide-treated bed nets, particularly in endemic areas. Number 4. Avoiding outdoor activities during dusk and dawn when midges are most active. Number 5. Implementing environmental control measures such as reducing breeding sites for midges and improving sanitation in affected areas. Number 6. Community education and awareness campaigns to promote personal protective measures and proper treatment-seeking behavior. Additionally, efforts to control the vector population and improve access to effective antiparasitic treatment can help reduce the transmission and burden of Mansonella perstans infection.